Today in news. There is many weight loss program in line, but according to the public opinion poll in 2016, the weight loss program provided by egimport.com ranked first and most effective system to lose weight fast and easy. Many doctors praised the program effectively. Also, too many of those who tried the program, they said was more effectiveness of the program has changed their lives. You too can learn more about the program. Just go on egimport.com and try it. Now we will watch one of weight loss advices. Remember best weight loss program in egimport.com. Having a weight loss coach or self-managing a diet and exercise strategy through use of DVDs and online tools can help patients slim down, researchers found. Patients who used either strategy, both of which were based on interventions from the Diabetes Prevention Program, DPP, had greater reductions in body mass index, BMI, over 15 months than patients who only had usual care. Jun Ma, MD, PhD, of Palo Alto Medical Foundation Research Institute in California, and colleagues reported online in the Archives of Internal Medicine. The DPP was shown to reduce the incidence of type 2 diabetes among adults at risk of developing the condition by 58%, but studies that attempted to put the program into clinical practice haven't shown similar success. Ma and colleagues noted that these studies largely involved a single group design, and few took advantage of information technology to keep patients on top of their programs. So they created two interventions based on the DPP and implemented them for overweight or obese patients at one primary care clinic in California's Silicon Valley. The patients all had either prediabetes or metabolic syndrome. Participants were randomized to one of three groups: a coach-led group intervention, a self-directed DVD intervention, or usual care. Both interventions had a 3-month intensive intervention phase involving 12 sessions of a DPP-based curriculum, which was delivered either face-to-face in a classroom or at home via DVD. That was followed by a year-long maintenance phase involving remote lifestyle coaching and support via an AHA website for tracking weight and physical activity, and through secure email within an electronic health record system. The primary outcome was change in BMI by 15 months. At baseline, the mean BMI was 32 and the mean age was about 53. At 15 months, Ma and colleagues found significantly greater declines in BMI for both the coach-led group and the self-monitoring intervention group than for those in the usual care group. By that time, those who had a coach lost 6.3 kilograms, 13.9 pounds, and those who had self-monitoring lost 4.5 kilograms, 9.9 pounds, compared with a loss of only 2.4 kilograms, 5.3 pounds, for those who had usual care. Both interventions also led to greater improvements in waist circumference and fasting plasma glucose, although only the coach-led intervention reduced diastolic blood pressure and triglyceride to HDL ratio, they reported. Ma and colleagues noted that women seemed to respond more favorably to the coach-led intervention than to the self-directed program, while men seemed to respond comparably to both. 5 serious adverse events occurred, 4 of which were in the coaching group and which may be related to the intervention, including 3 fractures and 1 chronic subdural hematoma requiring surgery. And the study was limited because participants were primarily of high socioeconomic status and from a single primary care clinic in Silicon Valley, so it may not be generalizable to other populations and settings. Nor did the trial evaluate event-based outcomes such as type 2 diabetes incidence or cost-effectiveness. Still, Ma and colleagues concluded that such programs will be critical to stem the tide of obesity and lessen its disease burden.